Unfortunately, sometimes our patients just want company. But home health aides are provided to beneficiaries to provide personal care, not simply be company. Again, it's important to know Medicare regulations and what you're expected to do. It's not ethical to falsify documentation and not provide personal care for the patient, even if he requests it. If the patient refuses personal care, you must speak with your supervisor. Now let's move on to our next scenario. This scenario is intended for nurses. In this scenario, Mary is the intake nurse receiving a call from the local hospital. The call is from the hospital's discharge planner. The two are discussing a potential patient for the Medicare Certified Home Health Agency.
So tell me about this patient.
Well, she has a simple wound on her back. She needs some help changing the bandage because she can't reach it. It really just needs a little Neosporin and a Band-Aid, but she doesn't have anyone to help her. I'm not sure she's homebound either. So listen, I know it's technically not a complex wound or a skilled service, but I'm really worried about her, and I don't know how she's going to be at home alone when we discharge her.
Right. Well, unfortunately, it just doesn't sound like she qualifies for Medicare without the need for skilled nursing. We can't take her under Medicare. Would she like to pay for private care?
No. She's been asked. She says she can't afford it.
Well, hopefully she can find someone to help her at home, and she can go to her doctor when she needs her bandage changed.
You know, between you and me, she can't afford private care, and she doesn't seem to have anyone to take care of her on a regular basis. Could you just do us a favor this one time and take her on? It really would help me out. Just get her admitted for now, just 5 or 6 days.
I am so sorry. I really want to help you get her out the door, and we do work with your hospital a lot, but I just cannot take someone on if she is not homebound and she does not need skilled nursing care.
It's unfortunate that the patient does not have help at home and cannot pay for private care. However, home health under Medicare has specific criteria on when care is covered. To review, we know that under Medicare, care is covered if it involves the need for skilled care, the patient must be homebound, the care is for an acute need and is intermittent, and as long as the patient is safe in their home environment. In this case, the care required does not appear to be appropriate skilled care. Let's take a look at another scenario.
Great. All right. Excellent. Well, Esther, you're doing excellent. You look great. You're walking all around the area by yourself. You met all the goals that we set for you. I think you're ready for outpatient therapy.
Oh, wow. I don't think you were coming here to discharge me. I like having you come here. And I don't want to go to outpatient PT, especially in this harsh winter we're having. And if you come here, I can have my home health aides.
I understand, but you met all your goals that we set for you, and you're no longer homebound. So just because the weather's bad, it doesn't justify me coming here.
Well, Mike, I haven't left the house since I had surgery, and I don't really have to leave the house. I can stay here as long as you come and I have my health aides.
Right, but think about it. Since your surgery, you've had dramatic improvements, and you're no longer homebound anymore. We do offer some private care visits at a cost, or we have some private care agencies in the area that we could give you a list of.
Oh, please, can't you just tell them that I'm not ready? And besides, I don't want to have to pay for expensive home care.
But Esther, I can't do that. I have to document everything that goes on here, your progress. But listen, maybe we can get you in touch with the social worker, okay? And she can talk to you about some of the free programs that we have. But in terms of Medicare, you don't qualify anymore.
Do you see the problem here? This patient used to be homebound, but the therapist, following policy, has evaluated the patient and determined that she no longer falls under the requirements for the home health benefit. She will be able to successfully ambulate on her own. A patient must be homebound by their medical condition and cannot simply choose to stay at home. A therapist or nurse is challenged with the task of evaluating the patient's eligibility with every visit. The therapist here is also asked to falsify documentation and claim the patient is still homebound. This, of course, is unethical and illegal. Let's take a look at our next scenario. This could happen to any member of the home health care team.
Hello? Hi, I'm up here. Hi. Hi, Barbara. Hi, how are you? I'm doing okay. Oh, great. Your door was wide open. I know. I can't answer the door myself. It's too difficult. It's too tiring. There's somebody here that helps you out with those things, right?
Well, my sister comes by on Thursdays for a few hours.
Well, what about it at night? Is the door unlocked?
Well, yes, but I make sure I ask whoever leaves last to shut it. But I need it unlocked for my visit the next day.
Are you able to get around?
Well, to be honest, I'm in bed for the most part. It takes too much energy. It's too tiring to get anywhere other than the bathroom.
What about food? Can you cook?
No, I don't cook. That's too exhausting. I eat snacks that I have here, and sometimes I may order some delivery.
The delivery person, they let themselves in?
Yes, it's easier that way.
Okay.
What is the problem with this scenario? The patient is clearly homebound, but she's living in a potentially unsafe environment. Is she safe the other 23 hours when home care isn't being provided? Not only could anyone walk into her residence, but she has no assistance if a fire or other emergency were to occur. This patient likely needs to be in a facility if she cannot arrange help from family and caregivers for each day. Or this patient might need to pay for private care. Regardless, if you're concerned about a patient's well-being and safety, those concerns need to be reported to your supervisor. Consider the situation with your supervisor to make a determination whether this patient is safe. Discuss whether you would need to contact Adult Protective Services. That can be a difficult decision, but it may be the right decision for the patient's safety. Let's take a look at the next scenario for medical social workers.
So listen, do you have any state programs that might be free for my mom?
There are some if you qualify for them. Your mother would have to qualify as low income and have no resources or finances available to her.
Oh, okay, all right. Well, she does have a house on the Cape, and we were kind of hoping we wouldn't have to disclose that, so you don't have to write that up in your notes, do you?
I have to take note of everything so she can be evaluated to see what programs she might qualify for. I have to ensure that help is available to those who qualify, and I need to take note of any resources she may have.
Okay, I understand. Well, if you can suggest any programs, that'd be greatly appreciated.
Medical social workers are there to direct patients to resources and guide patients through difficult and complex care situations. However, when a patient or caregiver asks you to falsify documentation, you cannot. Your job is to follow policy that is in place so that those in need can receive the help they deserve. As you can see, ethics and liability in home care can be tricky and may not be a black and white issue for any member of the care team. Aides, nurses, social workers, and all therapists can face tough situations. Remember to keep in mind these principles and practices and to communicate with your supervisors to provide the best care for your patients. This concludes our ethics and liability presentation. If you would like, please visit the link included with this video and test your knowledge with HC Pro's comprehension test.